Good afternoon to each of you, and welcome to our second episode of Heart-Centered Wellness. This month's topic, we're going to be focusing on anxiety, because as we look around us, we see that there are so many different things going on in our environment, and anxiety is manifesting all around us. I am Pastor Shalita Mira. I am a licensed clinical social worker and Ptsd candidate. I am the owner of the Heart-Centered Journey Counseling, Coaching, and Consultation. I'm also the author of the Heart-Centered Journey. With me on the panel today is the phenomenal Pastor Tuwana Lumpkins. Pastor Lumpkins, will you wave to the audience for us? Pastor Lumpkins is a licensed mental health counselor. She is a private practice clinician and a forensic mental health evaluator and a certified brain spotting practitioner. She will be joining us today, lending us her expertise as we explore the topic of anxiety. Also with me is the gorgeous Miss Arlesia Jones. She has a bachelor's in nursing. She is an endocrine nurse, and she is also a wellness, holistic, and fitness coach. So she's going to join us today as we explore the biological aspects of anxiety. And also the entire panel today, we're going to be looking at providing you some education on anxiety, some ways that you can identify whether anxiety is manifesting, whether it's personal or with someone in your family or your environment, in your community, and also some ways that we can implement coping strategies for anxiety. So why anxiety? Anxiety is a really important topic. And the reality of it is anxiety disorders are the most common mental illness. Last month, we talked about depression, and while depression is very prominent, anxiety is the most common mental illness affecting around 40 million adults in the United States. We're looking at ages 18 and older, so this statistic doesn't even include those individuals under the age of 18. So about 18.1% of the population is impacted with some symptom of anxiety each and every year. We know that anxiety manifests in so many different ways, and oftentimes we fail to understand anxiety and how it's manifesting in our lives simply because we may not have all the education that we need. And so that is our goal today as a panel, to provide you some robust information on the topic of anxiety. So as we think about anxiety, there are a couple of things I want you to keep in mind to kind of set the context. And we're thinking about COVID-19. COVID-19 is impacting the lives of every American, and not only every American, but this pandemic has impacted our entire world. But also, as you turn on your television, you see the racial conflicts, you see acts of police brutality, you see rioting, you see looting, you see protesting, you see so many different things happening in our communities. And did you know that every time you turn on your television, you are being vicariously exposed? And we're going to talk about that today, because even though you may not be on the front line, the mere fact that you're absorbing this each and every day through television or your social media means, it is having a significant and profound impact on your daily functioning. So we're going to start today with our panelist, Pastor Tuwana, and she is going to give us some information on anxiety. We're going to look at how anxiety is defined. What does the DSM say about anxiety, and what are some of the signs and symptoms, as well as some of the prevalent manifestations of anxiety. Pastor Tuwana?
Thank you so much, Shalita. It is a privilege and an honor to be here in light of everything that is going on. I thank God for you. I told you that before, and I'm telling you again, for following the lead of the Lord. This was pressed upon your heart for so many years. I know you've talked about this for years, and it's manifesting. And I think this time is perfect. I mean, I think it was right. It was waiting for a time such as this. So thank you for your platform. So as you've asked me to talk about anxiety, as described by the DSM-5, is a mind-body reaction to stress. It's a reaction to danger or uncertainty, exposure to traumatic and stressful events, unfamiliar situations, new experiences, changes in one's normal routine, changes in one's environment, changes can spark or trigger anxiety. It can prompt it. Anxiety can present as uneasiness. It can present as distress. It's the kind of distress that you feel before a significant event. And it's normal to feel anxious about some things. And a certain level of anxiety is really good because it's like the body's defense mechanism. It lets you know that you need to be on protection alert. And if you sense danger, we need to be able to feel like those goosebumps or, that's those somatic feelings when we are experiencing anxiety. However, for those suffering with an anxiety disorder, these mind-body reactions can be crippling. They can make it impossible to function in all areas of life. And we often mistake anxiety with fear, okay? As the two states, they do overlap. I mean, anxiety and fear do overlap. But while fear is an emotional response to a real or perceived threat, the DSM describes anxiety as an anticipation of a future threat. All right, it's an anticipation. Yes.
Yeah, talk about that a little bit, because I think that most people know the manifesting of anxiety in the moment, but the symptoms of anxiety even begin to manifest before, even in anticipatory stress or anticipatory anxiety. Yes.
Anticipatory anxiety. I like the way you put it. It's a response that occurs when you are expecting something. And like I said earlier, it's trauma induced. So if you're expecting something to happen, say for instance, you see vicariously, or you experience something that's happened to you in the past, or you experience something that hasn't happened to you, but you have preconceived expectations for it. So anxiety manifests that way. If you've been taught something, a certain thing, and we're going to get into it, I know, about the civil unrest that we are experiencing now. I'm the mother of a Black male, if I can go there. And he has talked to me. I've talked to him several times, and I continue to talk to him because he often wakes up just with his chest pounding. Now, he's never had a traumatic experience with the police, thank God. But because he's seen it, he's heard about it, he's anticipating that this may happen to him. And so he's exhibiting or displaying all of these things that I just talked about. Also, and I can give another, a more benign example, like today. I've spoken before crowds before, but those that I even can't see, those of you that are out there, I felt a little bit of my heart beat. I felt a little bit of my respiration speeded up. I felt a little bit uneasy. So that's also an example of participatory anxiety. Okay.
Yes, and thank you for explaining that, because as you stated, I have a significant phobia to driving over bridges. So when I have to go to Jacksonville, if I know that I have to go to Jacksonville and the place that I'm traveling to, I have to go over a bridge, if I know it 2 weeks in advance, I'm already feeling the anticipatory anxiety 2 weeks in advance. I will mull over trying to find alternate routes. trying to find individuals to drive me. Miss Jones knows we had an event over there one time, and she just happened to be, so she was kind enough to reroute and come pick me up.
Oh, that's
because
awesome.
yes, and because I am educated on anxiety and I know my body's response to it. So I know that's the next thing you're going to talk about. So share with us what some of the what our body does. What are some of these physiological signs and symptoms that we can kind of look for within us to know that we are experiencing some anxiety or stress?
Okay. So I actually meant to upload, and I think I sent it to you, an assessment that we use with anxiety. And I'm going to talk about what you just talked about, phobias. There are several types of conditions, disorders that fall under the category of anxiety, but we do want to talk about two of the major ones. One of them is generalized anxiety. Your anxiety, the anxiety that you just described, is generalized. It is generalized because it's a specific phobia. It's because the phobia of traveling over a bridge. So your anxiety is generalized. Anxiety can also be not so generalized. It can be pretty broad. You could have several phobias or things that can spark anxiety. But with generalized anxiety disorder, you can display excessive worry, just about everything or a number of specific things. You get restless. I describe with my son, he'll wake up, or not be able to go to sleep. And he's actually a military, he's ex-military, he's a veteran too. So we'll talk about some of that as well. Just being on edge, being edgy, maybe, your husband or significant other or your children, may come, maybe tap you while you're in the middle. Your body is somatically processing this anxiety and you're, what's up? Or what is this? Or I'm sorry, or a startled reaction. Also feeling very tired because your brain is working overtime. Your body is tense. Anxiety causes physical symptoms, tense muscles. A lot of people, a lot of clients, and I do too, I experience it in my shoulder and in my chest. And so your body is reacting to that. If you think about it, all of your muscles are tense. So you're just fatigued. And difficulty concentrating, are just having those blank moments. You are trying to work on a paper, a chapter of your dissertation, if I may. And all of a sudden, or you're trying to chart, Ms. Jones, you're trying to write that chart about that patient that you just saw and you walked out of the room, and all of a sudden, you go blank because you're experiencing anxiety for one reason or another. You can be irritable. Irritability, a person that you experience as being just very irritable and edgy, they more than likely are experiencing some type of anxiety and, sleep disturbances. Either you can't go to sleep or you're continuing, or you have trouble falling asleep and staying asleep, or when you're sleeping, you're just not satisfied. It's an unsatisfied rest. Okay. I have more.
Yes, please continue. Okay. Please share. We're absorbing all of this.
Okay, so I'm gonna go back a little and talk about anxiety and fear. We were talking about how the two states overlap and how fear is a perceived. It's an emotional response to a perceived threat, while anxiety is it's anticipatory. So fear is associated with the autonomic response, such as fight or flight. We know about that response one has in the face of fear. Anxiety, on the other hand, is a somatic phenomenon provoking, like I said, muscle tension, being overcautious or avoidant, ruminating over, like you just talked about, what am I going to do about this bridge situation? I'm just thinking about it. I'm turning it over and over in my head. Here, Sister Alicia comes to save the day. So those are all things that you can experience with anxiety. So individuals with anxiety disorder typically overestimate the dangerous situations. While, anxiety is something that we all experience, as humans. It's a part of humanity, but when you have a persistence with your experience, and it lasts over a certain number of times, 6 months. For children, it's usually a little shorter, but usually 6 months, you've had these experiences continuously. That's when it moves into the disorder category. All right, so can I give you a few statistics about
Oh,
anxiety?
yes, yes,
Okay, or do you
yes.
have any questions, either one of you?
No, I have a couple of points, but I'll wait till you finish because you
Okay.
hit on a couple of key things that I think is important.
Perfect.
One is perceived threat, and the
Yes.
other is the overestimation of the threat. But I'll
Absolutely.
save that until the end there.
Okay,
I'll yield to
wonderful.
Arlesia.
Wonderful. Okay, so like I said, they differ. What is considered normal anxiety or fear of being, normal anxiety or fear by being excessive, it's persistent. Like I said, it's stress induced or stress provoking. Either way, it's the persistence. So with the statistics, anxiety disorders are it's one of the most common mental illnesses in the United States, right up there with depression, which we tapped into our last podcast. And it affects 18.1% of the adult population in the United States each year. This is the disorder. This is like high on the spectrum. That number accounts for about 40 million people that are the age of 18 or older experiencing an anxiety, actually with a clinical diagnosis of anxiety disorder. So according to the U.S. Health and Human Services Office of Minority Health, adult Black Americans are 20% more likely to report serious psychological distress. For example, anxiety, as opposed to white Americans. So I found that very, very interesting, and very in line with our experiences. And this distress can be attributed to discrimination, marginalization, socioeconomic status, poor education, relative to mental health or in any manner, and limited access to healthcare. So access to healthcare is so important when you think about having access to treatments when it comes to anxiety and depression. So our access in the Black American community, we know is a problem. Disproportionate rates of death from COVID-19 and the recent killing of, and I'm going to name Ahmaud Arbery, George Floyd, Rayshard Brooks, and Breonna Taylor, and countless others. We are experiencing an increase in mental health issues in our Black American community. And aside from those socioeconomic things that I talked about, homelessness and joblessness, continuous exposure to violence, police targeting, blatant discrimination puts Black Americans at greater risks for developing symptoms of anxiety and serious mental health conditions like depression and the like. And according to the National Institute of Mental Health, Black youth who are exposed to violence are at greater risk for developing post-traumatic stress disorder, which we thought was just a disorder reserved for our veterans, but we learned that trauma, any type of trauma that we're exposed to directly or vicariously can prompt PTSD symptoms. And so we're 25%, over 25%, we're at greater risk for developing it by over 25%. So PTSD occurs when a terrifying event, either experienced or witnessed, triggers flashbacks. We relive the event. We actually put ourselves in the event. That's post-traumatic, like it's actually happening to us. We have nightmares and severe anxiety, and the sufferer is plagued by uncontrollable thoughts about the event and a display of irrational behaviors. And it's a display of irrational. You become irrational. Things that you wouldn't normally do if you were functioning normally, you do. And it can be terrifying. It can be misinterpreted. And I think that's what happens a lot of times. And sadly enough, when I look at the Richard Brooks situation, I really think about that, because he was already, incapacitated, as we know of the news, but startled and high stress, high anxiety. And so you react differently, even though in a normal situation, you wouldn't do some of the things that you do. So PTSD is very real. And it explains a lot of the reactions. Any questions before I go into the common types?
Yeah, let's park right there for a moment, because I think this is a great place for the panel to kind of discuss vicarious trauma, to talk about the irrational behaviors that are autonomic, so they happen automatically. And most people think, so let's just use the scenario. Mm-hmm. We are watching daily, we are bombarded with news briefings, and just in the last month, we have learned of 3, 4, 5, and not all of them new. Some of them are resurging now because of the Black Lives Matter movement, of interactions with African-American male and females and police overreach or police brutality that has occurred. And so when we're consuming this and we're seeing it over and over and over again, we must understand how our brain works. And so this information is impacting us physiologically. So we're visually seeing it, we're cognitively processing it, we're running through cognitively all of the scenarios. It sparks fear and anxiety within us, which is what vicarious trauma is. And we have not been the primary or, the being in the primary trauma.
Right.
And so now we've left our home, we're going about our everyday routine, and we're driving to the store, driving to work, and law enforcement now pulls us over. The first thing that resurges to our cognition, right, even though it may be subconsciously kind of stored, is everything that has happened. And so even though that may not be, our outcome may not be that which happened to our other minority brothers or sisters, we are still perceiving a threat, even though there may not be a threat. And that triggers anxiety.
It does.
So now you have the uncontrollable shaking, the brain racing, the shortness of breath, right? That normally law enforcement officers would look for, and they would deem that as, some suspicious behavior.
Yes, suspicious behavior, right.
What they fail to understand is those physiological responses are uncontrollable for the individual who is having in the moment what we would call a panic attack, or it's a manifestation of panic disorder. And so oftentimes they're misinterpreting the physiological response to anxiety and stress as a threat that does not exist. So you have two individuals perceiving threat. So there has to be someone who is able to de-escalate the situation. And what we're seeing is law enforcement is not trained in mental health first aid. They're not trained in responding to some of these physiological responses, and thus there is an overreaction. Because I can understand a person being in a car and law enforcement being in there, and them even saying at that point, I can't breathe, because one of the symptoms of anxiety is a chronic and extreme shortness of breath.
Yes.
Right?
Yes. You hit the nail right on the head.
Absolutely.
If I can jump in real quick, because I know that Arlesia has something to talk about with response to that. I just want to jump in really quickly. As you were talking about the interaction between the police officer and the individual that's dealing with the police officer for whatever reason. You have two people that are having a reaction to anxiety. They're both stressed, they're both anxious, they're both experiencing fear. And so if you can stay with me here, both reactions are irrational at this point. And we're trained as clinicians, all of us are trained that we be proactive and not reactive. We have to go through that training. We have to understand, we're trained about transference and countertransference. We're trained on all of those areas, and we have to make sure that we're cognizant and that we're thinking about those things when we interact with our clients as well. And you're right, police, any public servant that does not have proper training is in trouble when you encounter a situation like that. And so I am all for training police. Because I know some really good police officers. My husband was in law enforcement for a while. I have cousins, uncles, aunts that are in law enforcement. And so I hear both sides a lot. And they ask questions about what do I do if, and what happens when. And it's important. I mean, and for me to be there to explain it to them, that's a blessing for them. But what about the countless other police officers out there that don't have that particular training? And so I'm all for campaigning that police officers do take mental health first aid classes that teach them what to look for and that train them how to react to situations, or how to bring yourself to a place, or how to back off when you feel yourself in that situation, how to just back off and take a different approach. Because Absolutely. If everybody is in that same place, then it's a disaster.
Absolutely. And I just want to jump in really quick into your point with the officers receiving mental health training, that will give them extra knowledge in how to approach or de-escalate many of these situations. Like you stated, the civilian is stressed. The law enforcement officer is stressed. So sometimes it's just a combination of things or factors that ultimately, result in these unfortunate incidents. So my recommendation, along with police reform and, the talk about defunding the police, make it a requirement that when they're in academy for those 6 months, that they come out with a mental health first aid certification.
Absolutely.
So that they are, equipped with even more information as to how to deal or approach certain, people. There was an incident in, I don't know, was it Alachua or Marion County a few years back, with an autistic boy, in the police, and his father came to the scene, and it escalated to a point where no one lost their life, but it could have been handled differently had the officers been aware of how to deal with an autistic adult. You understand what I'm saying? So
Absolutely.
That would be my only, input on that.
That was great. I'm sorry.
Yeah,
go ahead.
and that's okay. And I certainly agree, because the reality of it is the law enforcement officer is the professional, and therefore the expectation is on the law enforcement officer to use the training and the skills to de-escalate the situation. Additionally, let's look at the statistics. We have a higher prevalence of African Americans who have these manifesting symptoms of anxiety and depression, and we're going to be talking about other topics. We're just focusing in on anxiety. But the reality of it is there's a higher proportion of African Americans who manifest these symptoms, but the help-seeking attitudes of African Americans is much lower. Hence, the individuals that you are going to be interacting with, whether you're law enforcement, whether you're pastors, whether you are clinicians, it's going to be individuals who may not even know their own triggers. They may not even know their own physiological response to stressful situations. But in each of these situations, the responsibility lies with the individual who is the trained public servant, not on the citizen. And so that it is incumbent upon our law enforcement agencies, and I know many of them have done a great push. I know Alachua County has done a great push on having 20%, I believe, of their law enforcement officers trained in mental health first aid by 2020. We as clinicians, medical and clinically, are advocating for this education, because the reality of it is many in our communities have manifesting undiagnosed mental illness. And so the response is to usher them to the place where they can get the appropriate help.
Absolutely.
All right, Pastor Tuwana.
I think great point. Because to add to that, and I'm not sure, and I am so proud to be a resident of Alachua County, and I'm proud about how they have been working on police reform for a long time. The captain in Gainesville, the captain here in Alachua, High Springs, all of those areas, they have been working for a long time to revamp our police departments and our approaches, and I commend all of them for doing that. It's been a long time coming. Nevertheless, if I haven't seen where they have mental health consultants on staff, or just someone that they can call and consult with, or someone that the police, not a consultant where the police go and they get their therapy. I'm for that too. I believe that's already in place, but a consultant that can actually talk with the police department or the agencies relative to the environment, what to do in this type of environment. Because let's face it, every environment is not the same. This one is a lot more charged because you have, politics, you have race relations, you have a pandemic going on. So I think that it would be wise to have consultants, mental health and healthcare professionals that law enforcement can lean on. Okay, so I'm almost at the end of my part. Just want to talk about, we talked about some of the symptoms of anxiety. I want to talk about another one. We talked about generalized anxiety, panic disorder. We touched on that too. It's also characterized by recurrent. It's a recurrent, unexpected attack. You can just be sitting and not thinking about anything, and all of a sudden you start to have palpitations, your heart starts to pound, you start sweating uncontrollably, you're trembling, you're shaking, it just comes out of nowhere. And you have shortness of breath, I can't breathe, feel like you're choking, chest pains. People, go in every day with these symptoms and think they're having a heart attack. Get on the stress machine. It's not a heart attack, it's a panic attack. Dizziness, chills, derealization. Sometimes, people can dissociate when they're having these, and they do. They often, going back to the Rayshard Brooks, I believe there was some dissociation there, not just because, there was some alcohol or whatever chemical going on there, but you dissociate when you're startled. You do. So yes. Some of that, feeling, out of control, like you're going crazy. I'm going to die. What's happening to me? My husband had a panic attack once. He talks about how he had it. And what he did, he went out and he laid on the street because my daughter they were still in school. He thought he thought he was going to die, and he didn't want her to come home and find him, dead. So he wanted to die on the street so someone else could see him and get him before. I mean, those kinds of things. That's panic attacks or panic disorder. Okay. So, and it is important, as I close, to note that an anxiety disorder, as you said, or as you touched upon, does have a high comorbidity to depression.
Yes.
There's a high comorbidity there. And so, yeah, we have to be aware and have understanding.
Yes. And thank you so much, Pastor Tuwana, for sharing that with us and for giving us that background information. And now we get the opportunity to hear about the biological piece. We've kind of talked about the psychological piece of anxiety, but I'm excited for Miss Arlesia Jones, who is not only a nurse, but an endocrine nurse, which is a specialized type of nursing that is highly physiological. So she's going to share with us some of the biological manifestations. And I'm really interested in her talking about how shortness of breath impacts the oxygen flow that goes to the brain, right? And how that impacts our alertness, our cognition, how we perceive our environment. Mm-hmm. Remember, we are biopsychosocial spiritual beings. So I'm going to yield to her, and she is going to share with us the biological side of anxiety. Ms. Jones.
Thank you, Pastor Shalita. Thank you, Pastor Tuwana, for giving such a great introduction to the symptoms of anxiety. So that actually was my first slide, majority of which you've already pressed upon, just some of the physiologic manifestations of anxiety, like feeling nervous, you're restless, you're tired, exhausted. Some people may exhibit extreme perspiration, sweating, right? You get nervous. What do? We sweat. We sweat under our armpits. We sweat, in places that we don't normally, sweat when we're faced with an imminent threat or danger, or perceived imminent threat or danger. I'll say perceived, because sometimes the danger is not always there, right? We tremble. Let's see, we have trouble focusing, concentrating. We experience gastrointestinal symptoms. So not everyone experiences or manifests their anxiety in the same way. Some of us have the GI symptoms. We have what we call the bubble guts, or we could have acid reflux at some point, a heartburn. You have difficulty controlling your worry, having the urge to avoid those physical or psychological triggers. Somebody might say something to you that brings back a memory, and it triggers some sort of anxiety, and it manifests physiologically. There are medical causes that are linked to anxiety. Example of medical problems that can be linked to anxiety include heart disease. So what is a big medical issue that we face in the African American community is heart disease, cardiovascular disease, right? And stroke. A lot of that is contributed, from physical, environmental factors. They play into the heart disease. We have diabetes. Diabetes, it's an imbalance of our insulin production, where our pancreas does not send out the insulin signals to then grab those extra sugars and break down. So diabetes often can cause forms of anxiety. We have thyroid problems, hyper and hypothyroidism. And I touched on a little bit of that last month in our talk about depression. But with thyroid problems, when we have an overactive or overworking thyroid, everything is sped up. Everything is hyperactive. So the body is, or the body processes are then sped up, right? So I'll just say, for example, I have a hyperthyroid. I can only sleep 2 to 3 hours a night. That contributes to my insomnia. I think Pastor Tuwana, you had mentioned on the trouble sleeping, the insomnia that comes along with anxiety. You may not actually have an anxiety disorder. You may have an underlying thyroid condition because that metabolism, everything is sped up. So you can sleep for 3 or 4 hours a night and feel fine, but then you're tired throughout the day. Why? Because the body has not really, given itself a chance to reset and recharge. You also have respiratory conditions that are, medical causes of your anxiety. And Pastor Shalita, you had touched on, different respiratory issues. What happens when we're under stress? Our breathing, our respirations increase, right? As a physiologic response. So the body is now reacting to that. Another medical cause would be drug misuse. And that seems to be, an ever rising problem in the United States. Opioid use, opioid addiction is on the rise. When it was introduced into the African American community in the 60s and the 70s, it was deemed, a crime. Now that opioid addiction is on the rise and our white counterparts, it's now a mental health issue. But that's another topic of conversation for another day. You also have withdrawal from alcohol as a medical reason that could contribute to anxiety. So I'm not, as familiar with the mental health piece and working in mental health nursing, but I've heard stories about patients coming into treatment facilities and going through alcohol and or drug withdrawals, and they experience, anxieties with the withdrawal of the substance. We also have chronic pain issues. When you have uncontrolled pain, say like after a surgery or injury, that could also contribute to your anxiety. Irritable bowel syndrome, that's another gastrointestinal cause or gastrointestinal symptom, IBS, that can contribute to that. Rare tumors, such as neopheochromocytoma, is a rare tumor that sits on the adrenal gland and it overproduces norepinephrine or epinephrine, and causing what we call the fight or flight response. So these rare tumors, once they're detected, they have to be handled with urgency. If not, the patient is in, compromised cardiovascularly, to have, a stroke or, MI or any of those other clinical manifestations. Those are very rare, but it does happen. And I have seen that in children where they have this rare adrenal tumor. So let me keep going. So we touched on the central nervous system. So, that's our brain. So that plays a huge role in the manifestations of our anxiety. Long-term anxiety and panic attacks cause your brain to release stress hormones, dopamine, norepinephrine, cortisol. These hormones send signals to target organs that then cause the organs or cause your body to respond in these physiologic ways: the increased blood pressure, the increased respiratory rate, the increased heart rate, which if uncontrolled for a very long time causes other sequelae that can ultimately, cause damage to your body systems. When you feel anxious and stressed, your brain tends to focus, your brain floods your nervous system with hormones and chemicals designed to help you respond to the threat. Adrenaline and cortisol. So I forgot to mention adrenaline. Adrenaline is found mainly in the adrenal glands, and you have 2 adrenal glands and they sit on top of your kidneys. The kidneys are what function for the urinary system and also in controlling and regulating your blood pressure. Cardiovascularly, anxiety disorders cause rapid heart rate, palpitations, chest pain. Pastor Tuwana, you touched on chest pain. That's a huge thing. We may not realize that it's just, an anxiety attack. We might think we're having a myocardial infarction, AKA heart attack, because the symptoms are very, very, very similar, right? If these things are not controlled, again, they can lead to coronary events. Next, we have the excretory and digestive systems, which I've already touched on. You have your irritable bowel syndrome, which can present itself with either chronic diarrhea and or constipation. Some of us suffer with ulcerative colitis, which is very similar, falls under the irritable bowel category as well. You can have a loss of appetite due to anxiety, nausea, diarrhea. What's that saying? The feeling of impending doom, you know, can manifest as a chest pain. It can manifest as a stomach pain, heartburn, things like that. Also, anxiety can trigger our flight or fight response in our immune system. So again, back to the adrenaline, the cortisol, and the norepinephrine or epinephrine. Sorry, those particular hormones send out the signals to our body to respond to the stressors. So I'm going to keep moving. I've already talked about respiratory, our respiratory system. So increase in breathing. If you have an underlying respiratory condition, let's say asthma, I'm asthmatic. You have in our senior population, COPD, that's chronic obstructive pulmonary disease. So, you know, our seniors, we have to, you know, just kind of monitor them, you know, a little more closely. Or our folks out there that are chronic smokers oftentimes develop COPD, which also compromises your breathing, your respiratory rate. So if you're experiencing anxiety and you're like a cigarette smoker, oftentimes you have the shortness of breath. But again, the smoking is, you know, clogging up those air sacs. Not enough air is being exchanged. The air is not moving. So you in turn think that I can't breathe, you know, then you start to panic. So I would caution my smokers, you know, I know we're under a lot of stress, you know, with the COVID, the things we're seeing on social media and TV, but if you can eliminate at least your smoking, that might, you know, increase your chances of maybe, you know, dealing with your stress or anxiety a little bit better. Even coffee drinkers, I've had to lay off the coffee. Caffeine can, you know. Yes, coffee.
That's where I wanted to go with caffeine. I said, when is she going to hit on caffeine?
And I'm guilty. I had my Starbucks this morning, and I had not had it in a week and a half, and had gotten back on my tea. But we have to be mindful about the consumption of caffeine, because that in turn will also contribute to our anxiety or our insomnia, not being able to fall asleep. You have to be mindful of even some of the supplements that, you know, we decide to take for weight loss. A lot of these things are not checked by the FDA. It's not FDA regulated, and they put certain ingredients in these tablets, and, you know, slimming teas, and, you know, we want to do all these things to, you know, slim down, but again, they're going to cause other physiologic manifestations in our bodies that, you know, we might confuse for, you know, something else. So we need to be mindful about our consumption of certain products. Also PTSD. Oh, I'm sorry, Miss Tuwana, you had a question.
No, I was just gonna make a joke. Can we have just one cup of coffee a day?
Well, since I had my coffee today, I'll allow you to have one cup of coffee today.
But I will work on it.
Okay. And if you must have coffee, try to switch to decaf versus regular. I know. It can be done. If I can do it, I know you can do it. I know you can do it.
Pray for me.
I think you all also had touched on post-traumatic stress disorder. So, you know, our veterans, but also just everyday, you know, regular people, even children. More children are now experiencing, you know, post-traumatic stress. I've seen that working in field case management. I've had a number of children placed on anxiety medication at such a young age, and I had not saw that working inpatient, in the inpatient and outpatient clinical setting, but now in the field I get to see that a lot more, and I'm really concerned, with everything, going on, and just how do we effectively manage and treat our anxiety. Pastor Shanita, you had a question? No?
No, I was just moving my hair out of my eye.
Oh, okay.
She was staying beautiful.
It's so pretty.
But you were talking about medication, and I think that is important as well, because there is a twofold piece to medication, and you're probably going to get into it, because there are some individuals who do require medication management in order to regulate their anxiety symptoms, and then there's also some medications that contribute to it. Right. So share with us a little bit about the medication piece.
So several types of medications are used to help relieve symptoms depending on the type of anxiety disorder that the person is diagnosed with, and whether or not it's mental or physical health issues. So certain antidepressants are used to treat anxiety disorders. And anxiety medication, I think the classification is benzodiazepine for your anti-anxiety meds, are prescribed in certain cases. I'm not sure if buspirone is still used. What is that? Wellbutrin?
No, buspirone is Buspar. It's still used.
Buspar, okay.
It's an older, yes, it's still used for anxiety.
Okay. So I know some things clinically are being phased out or have been phased out. So, you all would have to bring me up to speed on that. But medications such as sedatives, beta blockers, these medications are used for short-term relief of anxiety symptoms and not intended for long-term. Beta blockers, in most African Americans, we're not using those currently to treat our high blood pressure. We don't respond well to those. So if your Black patient has an anxiety disorder, that may not be a choice or recommendation you would want to use for their anxiety condition. So we have to tie in those clinical and of course the medical piece in that when tailoring our treatment plan to our patient. Yes, ma'am.
I want to comment on that because recently I had saw a trend in clients that I was seeing who complained of depression even and anxiety. And they, when I looked at their medication list, they had heart conditions and they were on 2 or 3 beta blockers. And so I noticed that trend, and I actually found an article where some doctors say, oh no, we don't have any evidence, hard evidence. But I'm glad you said that, because it lets me know that the medical community is also made aware that African American, just the way we process or metabolize, we don't do well on beta blockers. And a lot of times we are medicated for depression and anxiety, and not knowing that the cause is the type of beta blocker that they're on. And so I've been actually really, intervening and campaigning or advocating rather for my clients with their doctors. So I'm glad you brought that up. I really am. Thank you.
So I want to add too that really we need to push for more interdisciplinary approach, especially in the primary care setting.
Yes.
A lot of primary care doctors are assuming the role of primary cardiologists, psychiatrists, endocrinologists, instead of, making the proper referrals out to the proper specialist, and then doing the proper follow-up with said specialist. And communicating with one another. I noticed when I worked pediatrics in the hospital setting, and in my area in pediatric endocrinology, when we had diabetes clinic, you saw the endocrinologist, you saw the diabetes educator, which is the nurse, you saw the LCSW. We also had a PsyD that was on our team, and you saw a registered dietitian. all in one visit. So your visit may have been 2.5, 3 hours. However, you saw each of these team members. It is pertinent. It is pertinent that all the disciplines communicate and collaborate, and you have to tailor that treatment plan specific to your patient. Not every patient is going to be, your classic textbook, type 1 diabetic or primary hypertensive patient or renal failure patient. You have to communicate with one another, and one specialist does not trump the other. And I've seen that. I've seen, and I've overheard in conversation, doctors will, oh no, well, I think this should be done, and that doctor doesn't know what they're talking about. Well, get on the phone and have a discussion.
Right.
Set it up,
Right.
so that you all can come up with the best, treatment plan. And I understand that doctors are pressed for time, due to, the rules per insurance state. I can only spend 15 minutes in a room, with a patient. They have to see so many X amount of clients per day in order to meet their productivity. So we tend to lose focus about really taking care of the patient.
Right.
And the patient then just becomes a number. And I just hope going forward that as a community, medical and, and in mental health, that we really do our part to band together, join forces, so that we are doing more preventative care versus the chronic care that we are currently seeing. And you see the healthcare system is overflooded. In the hospitals now, on top of the COVID-19, we just don't have enough hands, or we don't have enough time to render effective treatment. I'm sorry, I'm going off on a tangent. But it's just so disheartening, and it's also very concerning at the same time. But if we don't fix the problem now, it's only going to cycle out of control.
It's going to get worse.
So that
and
ends
I
my
believe
piece.
this is okay. And I think this is this is the aim of our podcast, to provide our varying perspectives, to include those educational pieces, but to also talk to those communities. So we've talked to the law enforcement community. It's important to also talk to the medical and the clinical community about the importance of interdiscipline work, in addition to being culturally competent, because the reality of it is ethnicity does play a role in how our body functions. And so these cookie cutter medication regimens are not going to be effective, because the reality of it is if you're working with an African American female and a Caucasian female, our needs are going to be so different, because you have to look from that biopsychosocial spiritual perspective. And until we can work together interdisciplinarily to develop these treatment plans, life plans, whatever we want to call them, we're going to continue to be practicing. And I get that we're all practicing clinicians, but after a while, experience should teach us some things, and we're responsible. We're licensed clinicians. We're responsible for the care that we give to those to whom we are blessed to serve. And I do see that as a blessing. So thank you so much, Ms. Jones, for sharing with us the biological piece. Before we end the podcast today, I do want us to give some coping strategies. So our last podcast, we each kind of shared. So what I'll do is I'll start with you, Ms. Jones. If you want to just share some coping strategies with our audience today, some tangible things that they can do for anxiety management or anxiety reduction.
Of course. So I myself like to indulge in a lot of physical activity. The last couple of months, I had kind of slowed up, but I can happily say since the start of June, I'm back on my exercise routine. I'm feeling a lot better. I'm sleeping well at night. So some lifestyle changes that can be implemented to relieve some of your anxiety and stress, of course, would be to, one, let's get enough sleep. We need to make sure that we're getting at least 7 hours of sleep. 8 would be, great, but 7 really is optimal to rest and recharge your body. We can also implement prayer and meditation, whatever your faith may be. Have some quiet time in the morning and at night, just to turn off your brain, connect with your creator, connect with the Lord.
Amen.
Ask him to speak to you, ask him to calm your mind, your body, your spirit from, whatever was stressing you during the day. A lot of us, are career working people, and we oftentimes come in contact with many people, and we may, experience, the energies or the heaviness from, from certain individuals, and we just need to take time to just release and sit in the quiet, and do that. Staying active, exercising. If you're not a gym freak or a cyclist, walking 30 minutes a day, 5 days a week is sufficient. Get out in nature and walk 30 minutes a day. Eating healthy, your diet is important. Maybe doing fruit and vegetable smoothies, adding coconut water to replenish your electrolytes. Sometimes we could have, an electrolyte imbalance, and we might not even know it. It's summertime, so we need to stay hydrated, lots of water. Avoid alcohol consumption if at all possible. I love my wine, but I will indulge, on the weekend, 1 to 2 glasses on the weekend, and that's it, with my parents, and we sit around and we watch movies. Find a favorite hobby or pastime. That would also help. Avoid your caffeine. Pastor Tuwana, we need to switch to decaf. I'll send you some.
Oh, thank you.
Some
Thank you.
decaf.
I need to get back into my teas anyway. So
yes, I would say incorporate herbal teas. If you experience a lot of indigestion or heartburn, ginger root is good. If you experience a lot of joint pain and inflammation, turmeric tea is also good. For sleep, you can try chamomile, and there is, I found a lavender tea. You can incorporate that. Also, if you have issues with blood pressure, I've been experiencing that with the stress from work. So my mother has now incorporated hibiscus tea into my regimen. So every morning now I have a cup of hibiscus tea, and usually you can find that at a Caribbean market. So like here in South Florida, we have plenty of Caribbean markets, and even our grocery stores have a Caribbean and Latin food section. So I tend to grab the hibiscus tea from there. And avoid smoking if you're a smoker. That's really important, not only for our mental health, but also our respiratory and cardiovascular health as well.
All right. Thank you so much, Pastor Tuwana. What coping strategies do you have for our audience today?
So our sister Alicia Jones did such a wonderful job, Nurse Alicia, in giving coping strategies. So I will just append or amen everything that she just said, because those are the very coping strategies that I recommend for anyone experiencing anxiety. I often tell people that at the end of the day, you should shed yourself of everything that you've taken on vicariously. And we take on a lot vicariously at the bank when the teller doesn't, come to the window on time because she's having an issue. Now that affects you, that's outside of our day-to-day work as counselors, as therapists, as public servants. We experience. So at the end of the day, if it means just sitting and staring at the wall and doing nothing for 5 minutes. And 5 minutes is a long time, by the way. When I'm teaching my clients how to meditate, I have them start off meditating, doing 3-minute meditations at a time. Because 3 minutes is a long time, even 1 minute. So doing that. I do also recommend for anxiety. There's a tactic, a technique. And it actually wasn't developed by a psychiatrist, it was actually developed by an ophthalmologist, and it's called Convergence. And, that's helped a lot. And I can show you all how to do it. If you're having anxiety, if you feel yourself becoming anxious, if you feel that attack coming on, you hold your 2 fingers right in the middle of your eye, the line side of your eye. You hold them, you look at them for 10 seconds, and then you look away, just right past them on whatever point, the wall, whatever, and then you look, and then you look. You just go back and forth. It's called Convergence, and you will be surprised at how much better you feel after that. I do it often. It works. Trust me. So, and that's something that you can quickly do to de-escalate yourself when you're experiencing anxiety. And so, aside from what Arlesia has already graced us with, the meditation, whatever music you like to listen to. I love listening to calming music. Doesn't have to have words at all. That's the best music. And just sit and meditate with the word. I can take a scripture and I can go over it over and over again, and just, take it in, meditate. Whatever your religious practice is. And that's it. That's, you want to try to do all of those things before you delve into medication. Of course, anything that changes our body chemistry cannot be good for long periods of time. But drinking the tea, the exercise, a hobby, picking up a hobby also is a de-stressor. And all of those things. So that's what I have to say.
Thank you so much, Pastor Tuwana. And I'll leave you with a couple of strategies. One of the strategies that I like to share with my clients, those who I work with, is you have to educate yourself about yourself. Mm-hmm. So in the comment section, we're going to leave you a variety of tools. Pastor Tuwana talked about one earlier, which is the Gad Assessment, but there are several assessments out there that help you identify your physiological manifestation to anxiety. You have to know how your body responds to anxiety. How do I know I'm anxious? Well, some individuals may shake. I know that I am anxious because I sweat profusely. And anyone who perspires because of anxiety knows that the type of sweating that you do when you're anxious is completely different. It even smells completely different.
Yes.
From when you're doing your normal perspiration.
Mm-hmm. That's right. That's right.
Right. And so when you know those things about yourself, then you can develop your own coping strategy. So I have my own routine of things that I do when I'm going into what I perceive as high stress situations. And they may not even be extreme things. For me, doing my sermons can be physiologically, until the spirit takes hold, it can be, especially on the social media platform, adjusting. It's different than being in the sanctuary in front of your members. It can be somewhat anxiety provoking. Mm-hmm. We talked about my bridge experiences, but you have to know how your body responds to anxiety, and also what are your triggers? What are those things that trigger those responses? Sweaty palms, vacillating thoughts, difficulty breathing, or hyperventilating. Mm-hmm. They may cause this fear, avoidance of certain places, mm-hmm. this preoccupation that you have. Know your triggers. know your body's response. And then once you know those two things, you can then find different strategies that Pastor Tuwana has talked about, that Ms. Jones has talked about, to facilitate the calming piece of it. While it may not completely rid the anxious symptoms, what it does do is it will decrease it enough to where it becomes controllable. Mm-hmm. And the other thing I want to leave with you is so important, because we did not talk about social anxiety today,
yes.
But we will talk about this when we do our anxiety part 2, because when we are continuously on social media over and over and over again, that is another way of what we call the dopamine hit, right?
Mm-hmm.
We have such approval addiction, which is the opposite of social anxiety.
I love it.
And so we're on there because in this era of social unrest, in this era of COVID-19, we're dealing with things such as isolation, job loss, we've never had to deal with before. And so we're going to social media and we're posting things and we're sitting there. Who's going to like our post? Let me check back. Who liked my post? Okay, nobody liked my post. Now I'm personalizing the lack of response, or you have people inundating. They're spending their entire day on social media. Fast from social media, fast from these technology devices. Take some time to sit with God and with yourself so that you can feel restoration in this season. It is vital for your mental and physical wellness. You would be surprised of how many things are environmental, that if we would simply restructure our environment, life would be so much better and less anxious. So those are the coping strategies that I have for you today. I want to take this opportunity to thank the panel for spending this time with me today. Again, our goal is to provide you education, and we're specifically focused on the African American community. And while we're focused on the African American community, of course, it's our community of culture, but also to share to share the education that our community needs. So we thank you for tuning in with us. You'll see us again next month, and we'll share what the topic is going to be as we join together for your heart-centered wellness. Be well. God bless. Bye-bye.
Bye. Bye.